Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Got to open my mic. Welcome back to another episode of Superhuman Radio. Today is September 21st, 2020. We're going to be talking about a new method, potentially of early detection of cancer. You can beat cancer if it's detected early enough. We know that. And really, detection is where the magic resides. We're going to be talking about some great information out of Exeter, University of Exeter. Before we do that, we have to thank our title sponsor, Legendary Foods. The website is eatlegendary.com. The code is SHR10 for 10% off your entire order. If you're low carb, low sugar type person, high protein type person, and you want to snack and stay in your lane, it all begins at eatlegendary.com. They have the best nut butters. They have something called a tasty pastry that is basically a Pop-Tart with 9 grams of high leucine protein, less than 1 gram of sugar. And they also have the best seasoned nuts in the world. Check them out. Go to eatlegendary.com. Use the code SHR10 for 10% off. And now we will bring my guest on. And that, let's get rid of that. And that's Dr. Sarah Bailey from the University of Exeter. How are you, Dr. Bailey?
Hi, I'm very well, thank you. Very well. Thank you for having me on the show.
No, thanks for being here. This is exciting. As I said before, really, early detection is where the magic is when it comes to cancer. If we know someone has cancer, the earlier we know, the sooner we know, it could be handled so quickly that the person may never have any of the symptoms of their cancer. So finding ways to detect cancer that are more efficient, less invasive, is really where the magic is it not?
Yeah, absolutely. I mean, definitely the earlier in the disease progression that it's diagnosed, the more curative treatment options are available. And that all starts with early detection.
So why this study? What work preceded this paper we're going to talk about today that made you look in this direction at platelets?
So back in 2005 in the UK at the University of Exeter, a study was carried out to try to identify early markers of lung cancer. And lung cancer is one of the types with the poorest survival and the most people diagnosed at a later stage where the curative options are limited. And this study looked at a whole range of features that could have been markers of that cancer. I'm just going to distinguish between risk factors and risk markers. So when I say risk markers, I mean things like coughing up blood, or in this case, high platelet count. Whereas a risk factor is something that means you're more likely to develop cancer in the first place, like smoking or obesity. So in this early lung cancer study, the team at the University of Exeter really cast the net wide and looked at a whole range of physical symptoms, but also blood test results that could potentially be pointing to a lung cancer, an undetected lung cancer. And platelet count was thrown into the mix, not really because they believed that it was going to be significant, but as I say, it was a casting the net wide exercise to try and find some way to identify these cancers earlier to improve survival. So a platelet count is measured in a standard blood test, what we call a full blood count, and that covers various counts of cell type, red cells, white cells in the blood. Platelet count has largely been ignored up until this point, at least in primary care, because it's quite reactive to a lot of things. Any kind of inflammation can raise the platelet count. Any kind of bleeding can cause a raised platelet count. So because it's not particularly specific, it wasn't particularly useful. But in this lung cancer study, platelet count came up surprisingly in the model as something that did predict a future lung cancer diagnosis. It was around 14% of people with lung cancer in that study had a raised platelet count in some time in the year before they were diagnosed. And this is particularly significant in the UK cancer setting, because 90% of people with cancer go to a general practitioner, what you call family doctor, before they get diagnosed. It's a really crucial setting for that early diagnosis, because that's the point where we can hopefully intervene to pick up on these early signals. So a few years down the line from that point in 2005, the research group where I currently work had decided that it was time for a bigger investigation of this raised platelet count flag to find out more about it. And that's the point that I joined the group with a study that looked at the sort of diagnostic usefulness of platelet count in identifying any types of cancer. Because although the initial count was for lung cancer, we had a couple of other studies in the group that had looked at platelet count. So we thought, right, let's just start, rather than with people with cancer and looking back for markers, start with people who have this raised platelet count, and then look forward in their diagnostic journey to see how useful that was at detecting a cancer. So that was phase one.
Okay. And so you had a cohort of how many people were in that database that you were able to examine?
So at the point that I came in, where we really started to examine the platelet count in detail, that was an initial group of 50,000 patients who'd had a blood test in UK primary care setting. So we didn't know at the time of data collection why they'd had the blood test. It could be all number of reasons.
Right.
And actually, they're done almost indiscriminately in the UK, and almost for any reason and none, just to sort of have an idea of what the various blood counts are doing. So that was a huge study with a lot of data. And we exclusively studied people with a raised platelet count. So the normal range is 150 to 400 times 10 to the power of 9 per litre of blood. And we studied 40,000 who had a platelet count over 400. And we compared them to 10,000 with a platelet count in the 150 to 400 range, because we needed a kind of baseline to
you need a control.
Precisely, a control.
Right.
So this is the first study to conclusively study platelet count as a risk marker of cancer. And the results were absolutely phenomenal. We found that 12% of, I've just given you the wrong, 6% of women and 8% of men with this raised platelet count went on to be diagnosed with cancer within a year. And that might sound like small numbers, but that's phenomenal for detecting cancer.
Well, I was going to say, and many of those, their cancer was already advanced. So if someone was paying attention to their elevated platelet count, let's say 2 or 3 years earlier, then there may have been a chance to actually go in there and treat them.
You are absolutely right. So we looked at that in the study, and a third of the patients with cancer didn't have any symptoms before they were diagnosed that would have alerted the doctor to the possibility of cancer, other than this raised platelet count. So if anything, it was even more exciting, because we could say, okay, so potentially for a third of people, they could get diagnosed up to a year earlier based on this, and hopefully get into that curative early detection point in the disease that's crucial for survival.
Did you use any identifiers to stratify or potentially eliminate some of the people from being chosen in the cohort? The reason I say that is because there are people who have primary, what are they called? When you have high platelets, there's a name for it. Polythrombocythemia.
Yes. You're right,
yeah. So there are people who have that as a primary disorder, not a secondary. You're looking for people who have a secondary condition that's elevating the platelets, correct?
Yes. So we were looking for people with secondary or reactive thrombocytosis, where something's going on in the body. So thrombocytosis is the name of the raised platelet count condition. So we were looking for people who had the reactive type of raised platelet count. We excluded patients who had already been diagnosed with cancer before they had the platelet count, because they would already be on the radar. But aside from that, we didn't exclude anybody. We really wanted a broad sort of population-wide snapshot in that study. So once that kind of hit the news, that was big news, that finding. And the rate of cancer in the raised platelet count people was so high that we thought, okay, are we setting the bar too high for investigation? Should we be looking at sort of lower platelet count levels? If the risk is this high at 400, what is it at 350? Or what is it at 325? So the study that we published recently, and that's the subject of this interview today, is where we took a slightly different group of patients, slightly different cohort, who had a platelet count that was still in the normal range, but it was at that upper end. And we wanted to know if we did, in theory, select a higher threshold to be considered an abnormal platelet count, what would the implications be for cancer diagnosis? Could we identify cancer sooner? And so that's what we did. So in this one, we studied a much larger group. This was over 220,000 patients. We stratified them by platelet count. So we had the sort of comparison group that was the controls, if you will, in the 150 to 325 range. And then our higher normal group, which was the 326 to 400 range. And even in that group, we found a cancer risk of 2.7% for men.
Wow.
And 1.4% for women. So it's always slightly less for women for reasons we may come into later. But this is still an exciting result and has led us to asking a lot of questions really about whether we even have the right normal range for platelet count. And if this is something that should be adjusted.
Because let's talk about that for a second, right? All the ranges that we see as part of an assay in a lab are developed by looking at the population. Well, what does that do when a large portion of the population are sick? And we're using that as, and well, here's we see that with testosterone in men. The acceptable levels of testosterone in men are going down at labs. When I first started following testosterone, the bottom for hypogonadism was 420 nanograms. Now it's down to 320 nanograms. Why? Because the population is sick. They have low testosterone, and they're going, oh, well, this is the average in the population, so this has to be the low and this has to be the high. No, the population is sick. That's the low of the population. That's not the target. And that's what.
And the technology is improving as well.
Yeah.
Yeah, I mean, definitely in terms of like machines that analyze cell counts in blood have really come on a huge advancement since the platelet count reference range was set 30 odd years ago. And as you say, people are sicker. Also, we know a lot more now about the fact that men and women have different baseline platelet counts, but we just have one range for all, whereas actually perhaps it needs to be tailored in that case by sex.
So why do you think platelets are responding to an environment where there is cancer? Platelets serve a very important role, right? They are the primary clotting agent that allows blood to clot in the event of an injury or something like that, right? We need platelets. But what do you think is happening in the body when there is cancer present that's making platelets go up?
So this is hotly debated, and there's two theories. One is that platelets are causing cancer, and the other is that cancer is causing platelets. And I think it's likely to be a bit of both. So in the cancer causes platelets scenario, as the tumor develops, it's releasing all kind of hormones and growth factors that are affecting other processes in the body, which in turn are causing an increase in the production of platelets, or affecting other processes, which in turn are causing an increase in production of platelets. An alternative hypothesis is that something in the body is causing an underlying inflammation, which is another thing that causes a rise in platelets. And that background inflammation or inflammatory state is making a cancer more likely to develop. So the people already have raised platelet count for some other reason, and they're more likely to develop cancer. I think it's likely to be both of those working at the same time.
So Dr. Mikhail Blagasclony, who has been a frequent guest on my show over the years and published a paper in 2014. He was an oncologist. He's the author. He's the editor of several prestigious journals. he was an oncologist, and he was working with rapamycin and cancer. And he noticed distinct phenotypical changes in people that were getting rapamycin. They were sick less often. They seemed to be resistant to viruses. They looked like they were actually aging better. And so he shifted his focus from rapalogs and cancer to rapalogs and aging. And he was the first person to discuss this whole senescent cell theory. The bioaccumulation of senescent cells is what is aging, what we see as aging. He was just on the show a couple of weeks ago, and he said, now that I look back, we know that the older you get, the more likely you are to get cancer. That's a fact that everybody agrees on. And he said, now looking back, I realized that rapamycin worked to treat cancer tangentially because it made the body and the tissue younger by getting rid of senescent cells. And the younger the tissue, the less likely it is to develop cancer. So kind of staying with that idea for a second. And talking, we know that senescent cells are the most inflammatory cells in the body. They're producing all sorts of cytokines and chemokines, and they literally make the cells around them sick, and they become senescent, and this cascade of events occurs. Do you see any opportunity to look at, I know you can't go back with these people, and I don't know how much information that they gathered from these people. Like, do we know any of them that were already type 2 diabetic? Do we know any of them that had been had any chronic inflammatory diseases that would link to this idea that the increase in platelets is secondary to the inflammation? And obviously back then, no one was paying attention to senescent cells. It'd be fascinating to find out what the senescent cell load is of these individuals as well. What do you think?
Yeah, absolutely. So the study was carried out with a particular database that we have access to in the UK, which doesn't hold that kind of information, but we have advances all the time in data sets that are available to us, and new data sets are being linked together all the time. So that's definitely something that we could pursue in the future. In terms of what other conditions the patients had in our study, we would have data on things like other diagnoses and type 2 diabetes. And I mean, we really need to look into this. There's so much to be said for personalized cancer investigation, because in the UK, our doctors follow particular guidance published by the National Institute for Health and Care Excellence. And sometimes some of these guidances are offer specific advice depending on pre-existing conditions. But in the cancer guidance, the recommendations are not personalized to do pre-existing conditions. And this is something that we're going to be investigating in a huge new program grant that we've just been awarded at the University of Exeter. And we will be specifically looking at how we can diagnose cancer earlier in people with different pre-existing conditions. Because as you've already alluded to, in particular, people with type 2 diabetes are at much higher risk of being diagnosed with many different types of cancer. But our cancer risk profiles don't take that into account at all. So hopefully this new study will be able to address that.
You know, I don't know how it is there in the UK, but most of us here in the United States who are aware of disease states and we know that there are so many people out there today who have type 2 diabetes that are being treated with drugs like metformin and other ancillary drugs too, and even insulin. And once you get on insulin, your lifespan is shortened dramatically. Mm-hmm. So we know that these people, we are not allowed to say cured. You know, you can't say cured, but you can say managed. We know that these people should be reducing carbohydrate consumption in their diet as a form of therapy. But doctors are so reluctant to discuss nutrition because here in the United States, doctors don't really know any. They get a couple hours of nutrition in med school and that's it. And so there's this attitude here in the United States that what you eat really doesn't matter. You know, it's not going to affect. I mean, even with cholesterol, oh, well, you have the predisposition for high cholesterol. It's not your diet, or it's frustrating to me. Is it like that in the UK, or doctors talking to their patients and going, look, you can reduce your blood sugar levels, your insulin levels in 6 months. We just need to cut out the carbs. Let's focus on healthy proteins, lots of green vegetables, and let's, a Mediterranean style diet. Do they have those discussions with their patients there?
Yeah, I think there is a greater awareness from what you said in the UK compared to in the States about you can't just eat anything and expect to have and expect to be healthy. It does matter what you eat. It really matters. And we have like dietitians on the NHS who specifically advise patients on the kind of diets they should be eating and advising them on what to cut out or what to eat more of. But there's really something to be said for everything you've just described, really, the Mediterranean diet: eat leafy green vegetables, reduce cholesterol intake. I suppose the problem is it sounds easy when you say just reduce your cholesterol intake, but it actually changing your diet when you're used to eating in a certain way is really challenging.
Yes,
and very difficult. But with that increasing awareness of the problems coming from obesity, it's so important to improve our diets and eat more healthily. But I think there's a lot more to it than simply telling people what they should be eating. There's so much psychology involved in diets and eating and weight loss and gain that it's a really difficult thing to achieve for anybody.
Our problem here is even worse because we have big ag that the government subsidizes. The government subsidizes corn, for instance, and wheat. And so the government wants to get their money back, right? They don't want people going out there and say, hey, eating a lot of corn and eating a lot of wheat, probably not the best thing. The organizations that have authority to put together the suggested diets for diabetics tell them 250 to 350 grams of carbohydrates a day are fine. Don't be worried about it. But then they just up their insulin or they up their dose of glucophage, or it's a big frustration to me because I see this as we're this car pulling a motorhome up a hill, and we're losing cylinders. And at some point in time, we're going to have less cylinders working than the ones that are sick, and the car is going to come back down the hill and crash into a pile. And I feel like that's where we're going in the United States. Every year, more people become obese. Every year, more people become sick. Productivity is interfered with. And the rest of the people who are still working are carrying that load. And it's going to get to a point where we can't sustain illness anymore. But that's another story. So let me get back on topic, because this is a very important discussion, because going back and looking at your platelet count could tell. I mean, I keep every blood test I get the whole thing. I'm going to go back and look at my platelets and see where they are.
Yeah.
Once platelets are high, how do we determine what type of cancer we have? Is there a protein that is able to identify this cancer versus that cancer? What do we do with that information?
So the first step would be to discuss it with your doctor and see if you've got any other signs or symptoms that might point to a particular cancer. So it's worth remembering that actually, although a reasonably high proportion of people with a high platelet count have cancer, most of them don't have cancer. So it's still an unlikely diagnosis in that respect. So really a kind of discussion of any other clinical signs and symptoms you might have. And that should really be the starting point for any further investigations. And that will depend on that individual. And as we previously discussed, any other conditions they might have that might explain the raised platelet count. So certain conditions, arthritis, for example, there's a higher baseline platelet count there. It might even be that change in platelet count for that individual is more important than the actual threshold value or the actual result that they have. So if the platelet count increases in a short period of time, that might point to something else going on. Some people just have higher resting platelet counts. Definitely in women, baseline platelet counts are higher. So that's something that should be taken into account in any clinical assessment. We found that lung and go on.
No, I was going to, because we have 4 minutes before we have to take this break. Does platelet count change depending on where a woman is in her menstrual cycle?
I'm not sure actually, but it definitely changes as they hit menopause, and platelet count does drop after that time, and it also decreases with age in men.
Okay. All right. I want to take a quick commercial break. When we come back, I've got lots more questions. We're talking with Dr. Sarah Bailey about using platelet counts as an early warning sign that you may have some type of cancer. Stay tuned. We'll be right back.
When craving a snack, reach for Select Savory Snack Sugar-Free Biltong, the healthy alternative to sugar-laden beef jerky. They use a fattier cut of beef, making it more tender and flavorful. For mealtime, choose from their 63 seasonings, which are sugar and additive-free. From chipotle rub to savory pumpkin spice, you'll find an option to suit your palate. Go to shrnetwork.biz/SSS today. Use code SHR15 to save 15% on any meat snack or seasoning. Savor the flavor today.
Whether your goal is to build muscle or burn fat, you'll find everything you need at Redcon One. Need help getting a good night's sleep? Try Fade Out, the most popular pre-workout supplement on the market today, Total War. Sign up for their new Transformation Challenge and win $10,000. Or shop for apparel that people at the gym will know that you are serious about your training. Need a testosterone booster that works? Check out Boomstick. Whatever you need, you'll find the best quality supplements on the market at Redcon One. Go to redcon1.com. That's REDCON, the number 1.com, or go to superhumanradio.net and click the Redcon One banner ads today. Do you remember those delicious toaster pastries you had when you were a kid? You know, the rectangular sugar-filled snacks? Well, guess what? Legendary Foods has just made low-carb toaster pastry. This is the first of its kind, and honestly, these things are amazing. They have 3 to 4 net carb, less than 1 gram of sugar, and 9 grams of protein. You can eat them right out of the wrapper or lightly toast them. The only question is, which flavor, strawberry or brown sugar cinnamon? They're available at eatlegendary.com and Amazon. Are you still on the fence about Body Protection Complex BPC Oral from drseeds.com? Listen to Maggie Kuhn, one of the owners of the C-Bus Lifting Company gym in Columbus, Ohio.
I had been having some nagging tendon issues that weren't injuries, just things that were annoying. You know, I'm 58 years old, so just older tendon kind of issues. For us powerlifters, you know, we really don't stop training when we have just nagging issues. We just kind of keep pushing through. And I started the BPC. What I noticed was I was doing some heavy tricep stuff that would have killed me before when I had an elbow problem, and I was able to do this with literally no pain at all.
Go to drseeds.com, DRSEEDS.com. Use coupon code SHR and save 20% off your bottle of BPC Body Protection Complex today.
Want to improve mental energy and focus? Try the new Superhuman Stack from Pure Nootropics. Stack Dynamins, L-Butamin, Theocrine, and palmitoyl ethanolamide together and feel the lights go on in your brain. Find your perfect mix of these 4. Carl likes 1 cap of each and 2 caps of Dynamin. Bam! Lights on. Go to shrnetwork.biz/superhuman stack, all one word, today, and get yours for 25% off plus free shipping. That's shrnetwork.biz/superhuman stack. New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
This is the Superhuman Channel, where brawn and brains finally meet.
Welcome back.
Thank you.
Before we jump back into the show, I want to remind everybody that our live stream is back up again. If you have been one of the people who grew with Superhuman Radio by listening to it on your iPhone or your computer while you're at work, or we have people in the UK that they used to listen to the stream. It was the first time I ever heard the word "the tubes" referred to. I got an email from a guy saying, "I'm listening to your show in the tubes." I'm like, "What are the tubes?" Somebody said, "Oh, that's the subway there." Yeah. But if you go to superhumanradio.net/live player in any browser, on your computer, on your iPhone, you can listen to the show live streaming wherever you are. And you can email me at onair@superhumanradio.net during the show. And if you have comments and questions you want, we'll do our best to answer those. So check that out. So, Dr. Bailey, what about things like sleep apnea. We know that it elevates D-dimer and increases the thrombotic index, as do things like birth control pills. Let me rephrase that. As do things that are methylated and cause some sort of hepatic stress. They can increase the thrombotic index. Are those things having an effect on platelets, or are they doing it through some other mechanism?
That's a really complicated question. I mean, there's one of the tricky things with cancer and also with platelets is that so many things influence factors that can cause cancer. And then they all interplay with one another as well. Then there are individual risk factors that might mean that you're more predisposed to cancer given those conditions than you would have been otherwise. So it's a really complicated situation, especially with the platelet count. There's actually another factor in the body that's heavily influenced by many conditions. So picking that apart and the exact cancer platelet relationship from those other conditions is going to be a very difficult task.
Could testosterone be a culprit in shifting the burden to men? We know that higher testosterone levels lead to higher red blood cell count. Do the sex hormones play a role in the propensity of or the appearance of platelets in men versus women?
So that's another interesting question. Men are more likely to be diagnosed with cancer than women. So that's one thing to consider. When it comes to platelet count, we actually think that female hormones and women's bodies are reacting differently in terms of platelet count, and less so much the testosterone. So various hormones, and particularly with bleeding, that women are more predisposed to, can cause higher platelet counts in the woman, either through that, but other indirect hormonal influences that are leading to higher baseline platelet counts. So whether that in turn is making women more likely to be diagnosed with certain cancers than others, which isn't usually the case, or actually the link is less strong in women because their baseline platelet count is higher. So that's potentially masking any effect that cancer is having on the platelet count. Interestingly, when we looked at exactly what kind of cancers are being diagnosed in people with raised platelet count, prostate cancer was much less likely to be diagnosed in platelety patients compared to those with a normal count. So there's actually potentially a protective effect there. Conversely, in women, breast cancer was much less likely to be diagnosed. But then again, for both of these cancers, well, at least for breast cancer, we have an extensive screening program in the UK. Mm-hmm. So potentially it's more likely to be diagnosed early before the platelet effects are seen. Prostate cancer, that's a slightly different one. While we found that the lung and colorectal cancer were more likely, the lungs are a site of particular importance in platelet production. And this is evidenced by if you sample blood before and after it passes through the lungs, the blood post lungs has a higher concentration of platelet count than it does before it enters the lungs. So there's something going on there. Colorectal cancer is commonly accompanied by bleeding within the gut. So
I was just say, don't all cancers have some component of bloodletting when you think about it? Like stomach cancer, people vomit up blood. Colorectal cancer, we detect blood in their stool sometimes as an early warning. Is it possible that all of this is a result of tumorigenesis causes microscopic bleeding and the body's going, hey, we got something that's not stopped bleeding. We need to send some platelets over there.
Yeah, you're absolutely right. That's highly likely. And because prostate cancer is quite a localized cancer that doesn't really result in much bleeding, right, that would entirely fit with that hypothesis that it's essentially a factor that accompanies bleeding somewhere within the body. That's
interesting. So can you explain the difference between platelet volume and platelet count? So there's three in the research that I started to read about in preparation. There were three different studies. One of them from China that looked at platelet volume and cancer. And I would imagine, to me, volume means as a percentage of whole blood versus the actual number per liter.
Yeah, I think this is essentially the difference. Another factor that is significant in measuring platelets is activation.
Yes.
So the numbers and the activation are two separate things. And this is another avenue that I'm really keen for us to investigate in future studies, because I think it might be mean MCV in the UK. It's measured in a slightly different way. So yeah, we've definitely got more avenues to explore, particularly with the activation thing. And in fact, we were talking briefly before about athletes and platelet count in athletes, and platelet activation is higher following exercise. The human body's so complex.
But what does that mean? Does that mean that regardless of platelet count, they have to be activated to cause coagulation, right?
Yes. So there has to be.
This is why we see a higher thrombotic events in marathon runners 2 days after they've run a marathon, because regardless of total number of platelets, they're more active. They're like getting stickier.
Yes, precisely. So there's so the bone marrow is mostly where platelets are produced, and the precursor cell to the platelet is called a megakaryocyte, and this lives within the bone marrow, these cells, and they kind of send out protrusions into the bloodstream, and from the protrusions the platelets break off, or pre-platelets technically break off, that then become platelets, and these later become activated in a fairly complicated cascade of activation with various factors and hormones. So there's many opportunities within that process for different factors to influence what's happening. So there's the influence of the production and the maturation of the megakaryocytes to begin with. There's then the actual protrusions and the production of the pre-platelets and their conversion to platelets, which again is influenced by further cascades. And then, as we talked about, the actual activation of those platelets, which will prompt them to initiate their clotting processes at sites where they detect damage in the blood vessels. So sometimes that's in a correct way, if you've cut yourself to form a clot, and sometimes that's in an inappropriate place, leading to thrombosis in a DVT, for example, or someplace with damage inside the epithelium of the blood vessel.
I had a DVT when I was 330 pounds. I attempted to ride a bicycle down a hill, and I fell, and I had a DVT in my thigh that they had to watch, and it dispersed on its own because it was from a trauma. But yeah, no fun. It was very painful. So everything that seems to be anti-inflammatory thins the blood. Fish oil, aspirin, I mean, you name it. Anything that is seen as an anti-inflammatory, that's has any type of anti-inflammatory effects, NSAIDs, they have a blood thinning effect as well. Is that blood thinning effect a result of how it's acting on platelets?
Blood. Do you know what? I'm not sure. Definitely the platelets will play a part because they're so involved in inflammatory processes. They can't fail to be affected by all of those things. And systemic inflammation is affected by so many different things. As you said, the various drugs and conditions. Diet as well highly influences it. And platelet volume in the blood will affect the thinness or otherwise of the blood.
See, I keep coming back to inflammation, and then that brings me back to senescent cells. And the reason for that is that the FDA here in the United States has approved azithromycin for use as a senolytic drug, an anti-aging drug. I personally take a Z-Pak once every 6 months because a Z-Pak will eliminate 95% or 97% of all senescent cells in the body in 5 days. This is dramatic. This is amazing. And my good friend, my personal physician, who's also my friend, Dr. Matt Andre and I, we were talking about this because we were talking about a Z-Pack works for COVID. Like I have a sister-in-law who her husband was diagnosed with COVID. He suffered for 6 days with a very, very high fever. He's older. He's just quit smoking. And we told him, get your and the doctor wouldn't prescribe it. Finally, the doctor prescribed the Z-Pack for him. 2 days later, his fever is gone and he's already up and around. So
Wow.
The reason I say this is because my buddy, Dr. Andre, said that in his practice, and he sees a lot of patients, he sees a Z-Pack being a very powerful anti-inflammatory. He gives a Z-Pack to somebody for this reason, let's say a sinus infection or something, and they say, oh, my achy joints don't ache anymore, doc, and they've had arthritis or something like that. And so I keep coming back to senescent cells. I wonder what role senescent cells are creating this pro-inflammatory environment that leads to cancers and also stimulates the production of platelets.
Yeah, I can't speak for the anti-aging pills. It's not something I've ever come across, but it sounds phenomenal. Right. But there's definitely something to be said for the general body inflammation. Lots of things that cause inflammation, smoking, drinking, are also risk factors for cancer. So there's definitely something in it.
We're going to take our last commercial break, and when we come back, I want you to tell me what you hope clinicians take away from your research, okay? Stay tuned. We'll be right back with more Superhuman Radio.
Among the easiest and most popular ways to experience the life-altering benefits of hemp, Planet Earth CBD soft gels offer fast-acting effects as they release quickly. Made in a GMP-compliant, US FDA-registered facility, you can count on Planet Earth safe soft gels. These soft gels provide temporary relief from pain and so much more. Manufactured with the calming combination of chamomile and melatonin, you got yourself a long-needed CBD solution. 25 milligrams of nano-emulsified hemp extract per serving with anti-inflammatory agency. Planet Earth sleep-supporting soft gels will have you forgetting about today's worries for a better tomorrow. Unwind with Planet Earth CBD today.
Quest Nutrition makes bars, cookies, chips, and pizzas out of complete dairy-based proteins. Our products minimize net carbs and sugar without sacrificing taste. Each delicious chocolate-flavored chip, cookie chunk, and crunchy crumble is custom made to maintain Quest macros. It's time to enjoy foods that work for you, not against you. It's time to enjoy your Quest.
I love beef, and if you love beef, listen up. I've discovered the best tasting beef in the world, and that's not an exaggeration, at Piedmontese.com. The Piedmontese breed is famous from Italy for being lean and unbelievably tender, with half the fat and calories of traditional beef. Even typically tough cuts are tender when it comes from the Piedmontese cows. And for the first time ever, Piedmontese cows are being raised here in the USA. Get 25% off all beef and free shipping on orders of $100 or more at Piedmontese.com with code SHR. Go to Piedmontese.com and use code SHR today. You will never eat any other type of beef ever again.
Mind Bullet is a kratom product derived from the coffee family to boost energy and creative juices. Mind Bullet comes in both pill and liquid form for the ultimate pre-workout supplement. When needing a little pick-me-up or to get through the morning fog, Mind Bullet will set your productive course fast. Go to shrnetwork.biz/mindbullet, all one word, today, and save 20%. No subscription required. That's shrnetwork.biz/mindbullet. Get yours today.
Everybody wants to feel better, be healthier and happier. If you don't sweat profusely on a regular basis, you won't feel as good as you could. Studies have shown the power of infrared sauna. Infrared penetrates 1 to 2 inches into the body. It helps those with back pain, fibromyalgia, arthritis, depression, and anxiety. Patients get relief from infrared sauna. The Good Health Sauna has been shown to be an exercise mimetic, conveying many of the same benefits as cardio. There are a lot of reasons people buy a Good Health Sauna, but the bottom line is you will be a much happier, healthier person by using Good Health Sauna every day. You'll crave it, you'll love it, and it will be the best purchase you have ever made. Good Health Saunas provide commercial-grade saunas for in-home and commercial use, backed by the best lifetime warranty in the industry. Unmatched customer service and the best financing makes owning one easy and will fit any budget. Go to goodhealthsauna.com/superhumanradio to learn more and save 25% off. My friends over at Bioptimizers, makers of industry-leading digestive supplements, have created a special recipe for you that helps boost brain performance in the morning. They make products Primergen V and Primergen M,
potent liquid vitamins and mineral formulas loaded with absorbable vitamin Bs and trace minerals in a fulvic and humic acid base. You stack that with 3 capsules of Capex, their enzyme and energy supplement, and the effect is even stronger. You'll be buzzing without jitters or any negative side effects for hours. Bioptimizers calls this the Brain Boost Stack, and they're running a special promotion for you at shrnetwork.biz/brainstack. That's shrnetwork.biz/BRAINSTACK. You can get an additional 10% off from the normal package price with the coupon code SHR10. It's a powerful way to get your brain going and optimize your daily focus, memory, and performance.
Spit that out right now. This is the Superhuman Channel.
Welcome back. If you heard the commercial about the sauna, we're giving away a $5,700 sauna right now. It's a 3-person sauna. It fits in the corner of a room, has a very, very small footprint. If you go to shrnetwork.biz/free sauna, you can enter today. Once we get 300 entries, that's when the drawing will occur. So don't waste any time. It's 1 in 300 is good odds, actually. So there you go. Check it out. So, Dr. Bailey, what do you hope clinicians take away from your research?
The key message for clinicians from this research is to consider cancer when they see a patient with unexpectedly high platelet counts. And this can act as a real clue that there's an undiagnosed cancer somewhere in that patient. We saw from the numbers that actually a good proportion of people with cancer have no other symptoms of their disease other than raised platelet counts, around a third of patients with lung cancer. So my key message would be, when you're reviewing those blood test results, cast an eye over the platelet count, and if in the absence of any existing explanation for that result, recall the patient into your practice, bring them in, and have a discussion about what other signs and symptoms that patient might have been experiencing. Have they been coughing persistently for quite a while? This is obviously pre-COVID. In the present day, if you've been coughing for a while, you've got another kind of problem. Have they been experiencing persistent stomach ache? A lot of people are reluctant to talk about more embarrassing symptoms, blood in their wee, blood in their stools. Is there anything additional that they've been experiencing that they're worried about? And talk through those concerns with that patient and have a conversation about what to do next. Often those conversations would lead to further clues about what other investigations might be appropriate for that patient. But also, for the patients, I would also like to remind your listeners that most people with a slightly raised platelet count aren't harboring undiagnosed cancer.
Right.
And this can all sound quite alarming, I think, initially, but it is still quite a rare condition. And, trust your doctor, particularly in general practice. Doctors have quite a good instinct for what might be wrong with the patient. And although I look at things on a population level with really large cohorts of patients, at an individual level, the risk is quite different. And other things could explain the raised platelet count. So, choices about what to do next and what further investigations might be appropriate can be taken in discussion with that patient and what they want to do next with their results.
One of the discussions your doctor probably won't have with you, but you should know about it, is dietary interventions. There are literally a host of good studies out there that show specific types of dietary protocols that reduce whole-scale inflammation in the body. Those diets generally eliminate grains, starches, potatoes, and stuff like that, rice. Not forever. This isn't, I can never eat rice. It's just until you get, because what happens is, when we talk about inflammation, we're talking about the army of the immune system. I know people right now going, we know, Carl, we know, but I say it a lot because people forget this. The army of the immune system is inflammation. That's what goes out and fights the wars, suppresses the dangers, and then it's supposed to go back home and sleep. But when you're chronically inflamed, your house is on fire all the time, and your immune system is turned on 24/7, trying to put out all of these different fires and problems. Reducing entire body inflammation can be achieved. And it doesn't have to be drugs. you have to, there's good studies out there. Don't take my word for it. Just Google low inflammation diets. And what you'll see is you got to get rid of sugar and starches and grains for sure, beans, legumes, because they have anti-nutrients in them that are designed to keep bugs from eating them. Well, in low levels, they cause inflammation. And diets high in things like salmon, high quality animal protein, green leafy vegetables. Those are the diets that are going to literally change your body and its inflammation. And that may bring down your platelets. Maybe you don't have cancer yet, but something like as simple as that. Then I guess, and I was going to ask you this question. If a doctor is still perplexed, the patient presents no real symptoms, I guess then maybe if for some reason the doctor is concerned, could do like a radioisotope glucose test where they put you in a CT scan machine. They give you sugar that has been, the Warburg effect. You give you sugar that has been isotope. They watch where the sugar goes because cancer gobbles up glucose like it's going out of style. And they can actually track that glucose right to a site of a tumor or something like that. I guess that could be like if you're really worried and you want to eliminate any possibilities.
Yeah, so the danger with something like that is potentially an incidental finding or overdiagnosis of something that may not have caused you any problems anyway. Our data indicates that a lung cancer is most common or is most likely if you do in fact have a cancer with a raised platelet count. So a good first port of call would be a chest x-ray. Have a look and see if there's anything going on in the lungs. Or alternative, what we call a fecal immunochemical test, or FIT for short. This is a test that involves taking a stool sample and having it processed in the lab to look for the presence of human hemoglobin in the sample that might indicate a tumor in the digestive system. And we're actually evaluating that test now in the UK for people with very low risk symptoms of colorectal cancer. So not the things like visible blood in the stool or extreme abdominal pain or anemia, which are what we call red flag symptoms for colorectal cancer, but they're kind of low risk, much more low risk symptoms. And I mean, this is an absolutely phenomenal test. It's really good. So a colonoscopy is quite an unpleasant procedure to go through, and there are a lot of associated risks. Aside from that, in the UK, or maybe not so much of a problem for you over in the US, we've got a limited number of colonoscopies that can be done in any one time. And the waiting lists are huge, and they're getting longer by the minute. So we have to have a way of triaging people so that if you have a really low risk of cancer, we don't want to put you through that. So this fecal immunochemical test is a really great way of identifying those people who really do need to have that colonoscopy. If you have a negative fecal immunochemical test, your chance of having an undiagnosed colorectal cancer is virtually nil. You can relax. So it's an excellent test if there's a bit of raised platelet count, but no other obvious sign as to what might be going on.
We have that here now. The company is called Cologuard, and I recommend them. So for years I've been talking about the inappropriateness of so many of these colonoscopies here in the United States. In the United States, physicians get together, 2 or 3 physicians get together, they'll buy a facility and they'll do nothing but colonoscopies, and then they send their own patients to those facilities. So it's a money-making event. And the average colonoscopy in the United States costs about $2,500. And most of them are unnecessary. They really are. But more importantly, they carry a lot of risk. Yeah. Number one, there's a high level of introducing a bacteria when they don't you can't autoclave a colonoscopy device because it's got cameras and delicate equipment in it. So they have alternate ways of sterilizing them that not always works. And I've heard of numerous cases of people going and getting a colonoscopy and then coming back with C. diff or something like that. The other problem is that they could perforate your colon and cause all sorts of problems for the rest of your life.
Yeah, exactly.
So go get the stool sample test first. Then if you see something Now, okay, now we have no choice. We have to do a little something more invasive and see what we can see. The other problem with colonoscopies when they're unnecessary, as you pointed out a second ago when I said this elaborate, Warburg effect, and maybe we can do that. And you say, a lot of times you'll catch something that you didn't even need to bother with. Polyps in the colon are like mushrooms. They appear and disappear in days and weeks. They once you have a polyp, it doesn't mean it's, now I have that polyp. No, they grow. They're an inflammatory response. They grow and sometimes they disappear. And if there is in fact a polyp that is problematic, when they snip it to do the biopsy on it, they can actually, it's called seeding. Cells, when they snipped it, blood, when they snipped it, gets into the colon in other areas. And all of a sudden, you got dozens of polyps growing in that same area where you just had one just weeks later. And this is not a good thing. So I agree with you 1,000%. And in the United States, Cologuard was forced by the Food and Drug Administration because of pressure from physicians that order all, here in the United States, say, if you're 50, you got to have a colonoscopy every 4 or 5 years, like just rudimentary. You got to do it. And Cologuard was forced to make any kind of claims that it was potentially early detection, because the people were like, I won't go for a colonoscopy anymore because nobody wants to go for one anyway. Let's be honest.
Yeah. I mean, it's a very unpleasant procedure. And actually, if you have symptoms, have the FIT, the fecal immunochemical test with the screening of the stool sample. Don't go through that unless you absolutely have to.
No.
I mean, that's the problem with like full body scans and all that kind of thing. Like more often than not, you'll find something that otherwise you would have happily died at 85.
Right.
Without having ever known it was there. Right. But it's very difficult to understand that because you have this sense of just in case. We should do things just in case. But there are harms of diagnostic testing and definitely like that kind of incidental scanning for anything that could be wrong. But we also need to consider individual risk and individual people's perceptions of the kind of risk they're willing to take and what they're willing to go through for particular benefits or perceived benefits. Another good example is PSA screening, prostate-specific antigen, which is measured in a blood test. And that is a really non-specific test for prostate cancer. It has a very, very high false positive rate, all things considered, particularly if the man is asymptomatic. And yet the next step in investigation for that is a prostate biopsy, which is, if anything, more horrendous than the colonoscopy. So I'm told.
There are men who end up with erectile dysfunction after one prostate biopsy. And it's funny you say this. I did a show in 2009, maybe, with a scientist from Rutgers University. They found prostate-specific antigen in breast cancer tissue, which means it's not prostate-specific at all. Not at all.
That is not prostate-specific.
Whoever named that, they made a big mistake because PSA is found in other cancer tissue too. That was what he was saying. Like PSA is not indicative of prostate cancer; it could be indicative of some other cancer.
Yeah, I mean, all prostates produce PSA at a normal rate, and there's so much variation in what a normal level is for an individual man. And prostate cancer is also generally not an aggressive form. It's pretty slow growing. And you could put yourself through the stress and anxiety of the rest of your life knowing that you've got a prostate cancer when actually it wasn't going to do anything to you anyway.
You know what question most physicians fail to ask men before they evaluate prostate PSAs? Did you have sex last night? If you have an orgasm,
important question.
Your PSAs go up tenfold. They go because every time a man has an orgasm, it actually creates a micro trauma in the prostate. But in reality, I've talked about this study so many times. If you want to avoid prostate cancer, have lots of sex. Men who have more orgasms have less prostate cancer and less aggressive prostate cancer because the prostate's doing its job. So it's not getting old and funky and broken down. But interestingly enough, if you have an orgasm and then go have a prostate test done, a PSA test the next day, your doctor's going to go, oh my God, your PSAs are through the roof. They never say, hey, did you have sex last night with your wife or your girlfriend or whoever? Because that orgasm will raise prostate-specific antigen because it causes a microtrauma that's actually protective against things like BPH and stuff. It's lunacy. It really is.
Yeah, I think in the UK, men are actually advised to abstain from sex in advance of a PSA test for that exact reason, because it will mess with the results.
Absolutely. Absolutely. Which means I'd never be able to take a PSA test in the UK.
So many benefits.
I'm 62 years old. I'm trying to get as much as I can before things don't work anymore. So there we go. Listen, I want
that prostate biopsy. That's not going to end well.
Oh, that won't. I'm not doing that at all.
No.
I want to thank you so much for coming on the show today. I know it's quite late there, and I think this information is fascinating, and anything that can help someone get on target if they do in fact have cancer sooner, that I'm all for that. So thank you so much, Dr. Bailey.
Thank you so much for having me on. It's been great speaking to you.
Take care. We're going to take one last commercial break, and when we come back, I want to tell you about some things that are changing here at Superhuman Radio, and I need your support. Stay tuned. We'll be right back. You've heard me talk about the chill pill on the show and how effective it is at helping people who suffer from social anxiety, or sometimes when you just want to take the edge off to a long, stressful day. Well, listen to this story from Dylan Goutreau.
Definitely takes anxiety away, which I have a long history of having. Started out at 2 milligrams a day of Xanax. That was at 8 years old. And so I stopped using benzos 3 years ago. Extremely difficult. Yeah, so I spent about 3 years trying to find anything and everything I could that would be healthy for me to help with anxiety. Because I'm talking, full out panic attack. The chill pill was the first thing that I found that actually in the middle of a panic attack I can take, and it definitely subsides.
Go to drseeds.com. That's DRSEEDS.com. Use coupon code SHR and save 20% off your first bottle of the chill pill. Check it out. I promise this is one supplement that delivers.
Among the easiest and most popular ways to experience the life-altering benefits of hemp, Planet Earth CBD soft gels offer fast-acting effects as they release quickly. Made in a GMP-compliant, US FDA-registered facility, you can count on Planet Earth's safe soft gels. These soft gels provide temporary relief from pain and so much more. Manufactured with the calming combination of chamomile and melatonin, you got yourself a long-needed CBD solution. 25 milligrams of nano-emulsified hemp extract per serving with anti-inflammatory agency. Planet Earth's sleep-supporting soft gels will have you forgetting about today's worries for a better tomorrow. Unwind with Planet Earth CBD today.
Do you remember those delicious toaster pastries you had when you were a kid? You know, the rectangular sugar-filled snacks? Well, guess what? Legendary Foods has just made low-carb toaster pastry. This is the first of its kind, and honestly, these things are amazing. They have 3 to 4 net carb, less than 1 gram of sugar, and 9 grams of protein. You can eat them right out of the wrapper or lightly toast them. The only question is, which flavor, strawberry or brown sugar cinnamon? They're available at eatlegendary.com and Amazon.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
Chronic stress leaves us tired, distracted, and physically vulnerable. Apollo Neuro is here to help you take control. Apollo Neuro is a new wearable that trains your nervous system to be more resilient to stress. Apollo's gentle vibrations use your sense of touch to help you recover from stress, going from fight or flight to rest and digest so you can relax, get to sleep, focus, and stay healthy. Developed by physicians and neuroscientists, Apollo Neuro has been tested in multiple clinical trials and is proven to improve heart rate variability, the key biometric of stress. Special offer for friends of Superhuman Radio. Try Apollo Neuro today and get 15% off your purchase at apolloneuro.com/superhuman. That's APOLLONEURO.com/superhuman.
Whether your goal is to build muscle or burn fat, you'll find everything you need at Redcon One. Need help getting a good night's sleep? Try Fade Out, or the most popular pre-workout supplement on the market today, Total War. Sign up for their new Transformation Challenge and win $10,000, or shop for apparel that people at the gym will know that you are serious about your training. Need a testosterone booster that works? Check out Boomstick. Whatever you need, you'll find the best quality supplements on the market at Redcon One. Go to redcon1.com. That's REDCON, the number 1.com, or go to superhumanradio.net and click the Redcon 1 banner ad today.
This is the Superhuman Channel. Evolution just got kicked up a notch.
Are you wondering why I'm wearing this? I am so friggin' hot wearing this hoodie in the studio, because the studio is hot anyway with all the equipment. But you wondering why I'm wearing this? Because I wore this blue Quest shirt today, and for some reason, my green screen thinks it's green, and whatever's behind me ends up on my shirt. I look like a friggin' alien. I was like, oh, great, I got to wear this hoodie today. So, couple things. I am starting to promote our live stream again. The live stream is really what got me started in this business. Back when I used to do Off Topic, what made Off Topic famous was we had a live stream that people could interact with the show. And the same thing with Superhuman Radio. When I started doing Superhuman Radio with the live stream, that's when I got that email from a guy saying, I'm listening to your show in the tubes in the UK. I was like, what are the tubes? So I'm starting to promote the live stream again because I need to remove the power that Facebook and Facebook and YouTube have over the production of this show. Last week was a week from hell. I literally went home Friday night and drank wine because I was so friggin' stressed out from the week. Between YouTube claiming I made a post that I didn't, and I've messaged them no less than a dozen times now and said, fix your mistake. And of course they're ignoring it because they don't give a damn. They don't care. There's nothing I can do to them. They claim I made a post on September 11th about Osama bin Laden. I didn't. September 11th, the only post I made was, I think that was the day I did the show with Dan Matha. And that's what I posted. That was it. And they literally, like right at the beginning of the show, they shut me down. And all the Facebook videos, they only were like a second long or 10 seconds long. And then YouTube did the same thing to me the other day. Because some of the science, some of the reputable, legitimate science that I was talking about didn't fit their community standards, which is complete BS. They're not scientists. They're tech guys. So I am researching right now. I have a separate server. In fact, we're upgrading it. We're putting a brand new server in that delivers my stream. And it's real easy to listen to the live audio stream of this show. You just have to take any browser and go to superhumanradio.net/live player. A player will appear. You press the play button and you could listen while you're jogging, while you're working, while you're commuting, while you're doing cardio. I wouldn't recommend listening while you lift because music is better to listen to when you lift because it's more motivating. But if my voice motivates you, hell, listen to it while you lift. And I'm working on getting a video stream up as well. If I can get a video stream up, then I can't be shut down by these groups, Facebook and YouTube at all. And people will just come to my website to watch the show instead of Facebook. So I need your help. Those of you who are listening to the podcast right now, replay, if you're around at 1 o'clock in the afternoon, use the link, superhumanradio.net/live player. Listen live. And help me promote the live stream. That's number one. Excuse me, those of you watching, I'm coughing. I got to drink some water. I get this every day at the end of my show. The other thing is you can send an audio clip. I've been asking for video, but I get the feeling that people are shy and they don't want their videos out there. If you would record a brief SHR story, maybe it's you hate when I start coughing and I have to mute my mic. I have horrible allergies. It's because I was a C-section baby. If you could do like a 30-second, 60-second audio clip of why you like or don't like the show, and then upload it to shrnetwork.biz/yourstory, I would really appreciate it. I got to believe more people are willing to do an audio recording than a video for whatever reason. I don't know. But I need your help with these two things. The live stream is shrnetwork.biz/liveplayer. And to upload a video or audio clip of why you like or hate the show and me, you can upload that to shrnetwork.biz/yourstory. Help a brother out, okay? And we'll see you tomorrow with another episode of Superhuman Radio. Thanks for watching and listening today.